Hello, friends, and Happy New Year. Welcome back to What the Health with Dr. L, where I share with you brief answers to important health and wellness questions based on the latest available evidence to us from scientific medical research. And today's question says, Dr. L, I would like to have better health in 2021 and to get through the flu season with no major problems. What kind of advice do you have for me when it comes to food? When it comes to food, I always advise eating whole, natural food and staying away from processed packaged food as much as possible. When it comes to meat, I advise eating grass-fed meat. When it comes to fish, I advise having cold water fish as much as possible. We know that food is number one factor that causes chronic disease like diabetes mellitus, heart disease, obesity, and these chronic diseases, based on the statistics we got from the CDC in the United States, 94% of people who lost their life to COVID-19 in 2020, they had on average 2 to 3 chronic diseases together, comorbidities. Okay, so this is number one. Number two, also pay attention to the amount of water you're drinking to make sure that you do not get dehydrated, especially during the winter season. When we have not enough water, all our biological processes go very smoothly. Hormones work better, neurotransmitters work better. Add to this, water has a thermogenic effect. It helps us to burn more calories. And when we are dehydrated, things do not work as well, including our mitochondria. Okay? Best source of water for me is spring water. If you don't have access to spring water, invest in a water filter, because you want to make sure that the quality of the water you drink is reasonable. How much water you need to drink, it varies from one person to another, depending on the size, depending on the level of activities and all that. But in general, I advise people to drink in ounces, to drink half of their weight in pounds. So if you weigh 150 pounds, then you need to drink around 75 ounces of water per day. A cup of water has 8 ounces. 1 liter of water has about 34 ounces. So you do the math. To get through the flu season, I do not recommend too many vitamins and minerals. I only recommend 2 vitamins and 1 mineral. The 2 vitamins I recommend, vitamin D3 and vitamin C. And when it comes to minerals, I recommend zinc only during the 6 months of the flu season. Okay, vitamin D, of course, how much you need to take depends on your blood test. But until you get the blood test done, you can go ahead and take at least 1,000 international units per day. You can go all the way up to 4,000 international units per day, especially during the winter season. We know that vitamin D3 signals all the anti-inflammatory molecules and downregulates the pro-inflammatory molecules. It helps people to avoid getting common cold, flu, and lung infection as well, especially in people who are deficient in vitamin D3, and it's a very common deficiency. When it comes to vitamin C, we know that vitamin C is antioxidant. It does help to downregulate inflammation. It helps to support the work of the immune system. It's water soluble. Unlike vitamin D, vitamin D is fat soluble, so you need to take vitamin D with a meal that has some fat, but vitamin C, you can take it without having a meal. I recommend 500 milligrams twice a day, but people who are on radiation therapy or chemotherapy or taking cholesterol-lowering drugs, they really need to be careful because vitamin C interacts with all these drugs, so they need to consult with their treating doctor first. Also try to avoid too high dosage of vitamin C. More than 2,000 milligrams can cause bad diarrhea for most people. Okay. When it comes to zinc, we know that zinc is very important for the work of the immune system. People who are deficient in zinc, they are more liable or at a higher risk for infection. We know that when we have enough zinc inside our cells, that helps to prevent the replication of RNA viruses, and the coronavirus is an RNA virus. So I recommend 30 to 40 milligrams a day, but not more than that, and only for the flu season months, the 6 months of the flu season, because long-term usage of zinc is associated with copper deficiency, which can cause anemia. It can cause also other problems with blood count and irreversible neurological problems such as numbness and spasticity. Okay, so the long-term usage more than 10 months. So I wouldn't be supplementing with zinc for more than 10 months. And of course, I have talked about natural, ways to get our zinc in previous videos. Also try to take high dosages of zinc, because too much zinc, like 100 milligrams or more, can cause stomach upset and can cause other problems like nausea and altered taste and all that. Also try to avoid nasal zinc, because it might cause loss of smell. Okay. And the last thing I would advise you to do is to increase your omega-3 ratio, because omega-6 to omega-3 ratio needs to be 3 to 1. This is how we evolved. In most people now, it's much higher. It's like 20 to 1 or even 30 to 1, and that creates a state of inflammation in the body. So the best way to go about this is to avoid all the highly processed seed oils like corn oil, vegetable oil, canola oil. Don't cook with these oils, because they are very high in omega-6 fatty acids. Also, you need to increase your ratio of omega-3 fatty acids by having fish. That's the best source. Cold water fish 3 times a week. Olive oil. Try to use other types of oil. There's algae oil and krill oil as well. But it's really, really important to make sure that ratio stays as much low as possible. It's very important for our health. Also important for our brain health and our ability to have patience and empathy and compassion for others. That's what I wanted to share with you today. Briefly, my best wishes for a beautiful 2021, full of good health, prosperity, and realizing all your dreams. Until next time, you guys enjoy the new year, and please don't forget to subscribe to your channel and share this information with all whom you know. All my love.